As the saying goes, health is wealth. Of course, that explains itself, but for the benefit of the doubt, it simply means that wealth comes to nothing in the absence, of course, of physical, mental, and social well-being of everyone. Now, sequel to that is the dictum that prevention is better than cure, and there are medical conditions to which this applies. Cancer is one of them. Cancer is among the leading, of course, cause of death worldwide, and in some countries we're told it is the second killer disease. Now, most cancer-related deaths occur in developing countries, and research reveals that by 2030, 70% of new cancer cases will be domiciled in developing countries. So let's zero in now on Nigeria. Available statistics is even more depressing when it comes to our country. We are told that 100,000 new fatal cases are reported annually. So with a population of over 170 million, Nigeria would automatically bear a greater cancer disease burden. Now, if there is any medical condition that everyone dreads, that will be cancer. The mere mention of the disease or diagnosis of the disease is capable of killing, the person. So why is cancer such a dreaded disease? Now, medical experts will tell you that the answer is in the nature of the cancer cells and the speed at which they mutate. Now, there are more than, several varieties of cancer diseases, and in fact, there is no part of the body that is immune from the ravaging cancer cells. But research again tells us that in Nigeria, breast cancer or breast and cervical cancer top the list. Others, we all know, prostate cancer, liver, lung, and so on and so forth. Now, according to research again, mortality rate from cancer is higher in men, than women. But regardless, we're told that sex plays a very critical role in the incident. Now, let's look at why, we are pursuing cancer prevention. That will also be a focus on today's program. And we know that, cure for cancer is still very elusive. And that's because of the many different causes that, now go beyond what we know, the traditional issues of smoking and dietary habits. Today we talk about radiation, chemicals, and so on and so forth. So this week on Date Edition, we not only focus on cancer prevention, but more importantly on how some individuals and institutions are standing up, to the more challenging aspect of the disease, treatment and management of cancer in Nigeria. I am Claire Adilabu Abdul Razak. Join me again. Dr. Amina Abubakar Bello is the executive wife of the Niger State Governor and chairs the Northern Governors' Wives Forum. Professionally, she is a consultant obstetrics and gynecologist. Basically, Dr. Amina Bello is an advocate of reproductive health rights of women. She is the founder of RAISE Foundation, which is a non-governmental organization dedicated to ensuring that no woman dies from pregnancy-related and other public health conditions. Now, her activities are, basically concerned with promoting cancer awareness programs and so on. But one important thing is that her foundation, RAISE, unveiled the first cancer screening center in Niger State, North Central Nigeria, which provides early detection and preventive therapy for breast and cervical cancer patients. Now, of course, Dr. Amina Bello holds membership positions in many national and institutions, and of course, medical institutions, including NMA, NDCM, African Institute of Public Health Professionals, and so on and so forth. Now, my other guest, Dr. Bello Abubakar Mohammed, is a chief consultant in clinical and radiation oncology at the National Hospital, Abuja. He spearheaded the establishment of a modern 3D conformal radiation therapy center at the National Hospital, Abuja. You'll get to find out what that is. He has over 30 years experience in medical practice and is currently the chair of prostate colorectal neuroendocrine tumors guidelines. Now, that sounds so much of the NCCN for Sub-Saharan Africa. Dr. Bello Mohammed is a frontline member of the African Cancer Coalition, an organization of more than 150 oncologists from 17 countries, also in the Sub-Saharan Africa dedicated to improving high-quality cancer treatment. Oh, Your Excellency, and Dr. Bello, thank you for joining me on today's program.
Thank you for having us.
I just want to clarify, you know, sometimes when I want to call Dr. Mohammed Bello of National Hospital, I call that, you know, there's no relation.
No.
Not at all.
No relation.
I know you're from Niger,
No.
Yes.
and he's
I'm from Bauchi.
so it's just a coincidence.
Yeah, Bello is a common name.
It's a common name.
Yes.
All right. Thank you both once again.
Abubakar.
Let's start. You know, when I was reading out the introduction, there were certain, you know, statistics I mentioned, and you were shaking your head. No.
Not exactly.
Okay.
The statistics are quite right that we've had in 2018 about 100,000 new cases. And out of that 100,000 cases, about 72,000 deaths. Now that's about 72% of the patients that were diagnosed actually die within the first 1 year.
Which of the cancers now?
Now, this is a whole range of all the cancers. But we do know that the most prevalent cancers in women are cervical and breast cancer, as you have mentioned. And the most important one for men is the prostate cancer. Where I was shaking my head is that you said men tend to die more than women. And that is a sweeping statement, perhaps, because there are so many factors that will make somebody to just die of cancer.
Okay.
Late presentation, and late presentation is what we actually see.
Okay.
You'll be surprised that over 86% of our patients present at stage 3 and stage 4.
Okay, let me put you on hold for that clarification. We'll get to that nitty-gritty. We've not talked about cancer generally, and I'd like to know if there is a standard age, you know, at which one can come down with cancer. Is there, Dr. Amina?
Well, not standard age per se. Cancer actually affects all ages, even newborn babies.
Absolutely.
Exactly. However, majority of cancers you see in the older age group because of aging cells, and as the body ages, the cells do not repair themselves well, and so you tend to have more cancer cases in the older age group. However, it can occur throughout the whole spectrum, from babies to infants to small children, adolescents, and the like. So there's no age restriction at all where cancer is concerned.
So share with us your experience. You know, you've been handling these issues, your foundation. Just share with us your experience on a daily routine, you know, with cancer patients.
Well, I think my experience with cancer patients started even before I started my foundation. Being a gynecologist, throughout medical school and practice, you see cancer cases. But the most, and I think most doctors will agree with me, is what stands out among our cancer cases is that 90%, he says 80%, but really it can be as high as 90%, they come late. And when we say late, it is a stage where there's really hardly anything that can be done for that patient at that stage. Eventually, that person is going to die from the disease, which is sooner rather than later. And that is what is more common for us here in our country. And another thing is that there are cases that could have been prevented, especially when you look at cervical cancer. It is one of the commonest cancers that we have here in Nigeria. In fact, in Africa, but for us here, is the second leading cause of death after breast cancer in cancer cases.
In Nigeria?
Yes. Yeah. Now, with cervical cancer, it is actually preventable because it has a precancerous stage, meaning it has a stage where you are able to detect changes that can lead to the cancer. And so if you are able to get the lady at that stage, you can treat her effectively and she will never come up with cancer.
Okay, I will come to ask you, you know, to share your experience, because when they come late, they should have reasons why, you know, they present late. But Dr. Mohammed, let's look at what exactly is cancer. We hear about cancer. Is it every swelling that you see in any part of the body that is cancerous?
So in a layman's term, cancer simply means uncontrolled proliferation or development of cells. Usually as you grow every day, some cells die, some are formed and some die. And this is controlled by the genes in the body. Now something happens to the genes, what is called mutations, and they can no longer control that development of the cells, you know, growing and dying and so on. So they become immortal. Okay, so cancer cells are basically immortal cells because they don't have control. And that's what we call mutation. And what caused that mutation are the risk factors that we talked about. You know, when you look at breast cancer, for example, you know, there is a mutation that one can actually inherit, what is called the BRCA gene mutation. So if a woman has that mutation, she has the tendency, it's about 60% more likely to develop breast cancer than the ordinary person that does not have that mutation. So basically, if you have mutations for many of the cancers, you are likely to come down with it. Okay? So uncontrolled development of cells lead to cancer. And that is caused by mutation, and mutations happened when certain genes, yes, are mutated. Okay. And they fail to continue to guide the development and the normal death and normal growth of those cells.
Simple enough. I know you receive patients at the National Hospital. Give us a sense of what your day is like.
Well, a very interesting one, actually. So I'm a clinical and radiation oncologist. What that means is that I do two things: medical oncology practice as well as radiation oncology practice. Now, let me talk of the radiation oncology only. In this country, we require about 180 machines based on WHO guideline. And yes, and we have less than 5 in the country. At the time, we had none functioning. Sometimes in 2017, around October, we had none functioning. And that was why the then Minister of Health came to the National Hospital and saw that there is a machine in the crate and decided that, look, that machine has to work. And he engaged us all to make sure that that machine became functional. And we were able to make it functional, and it was the first machine actually that became functional in December 2017. And it has worked up to today. So we sometimes treat up to 100 patients.
With how many machines?
With one machine.
One?
Yes. The standard is usually 35 to 40, but we overstretch. That's why sometimes we work till 1 a.m. in the morning, and the people that are actually staying behind to do the treatment, the therapy radiographers, are so few in the whole country. In fact, as I'm talking to you, the National Hospital is looking for therapy radiographers to employ, but they are just not there.
At what stage?
They are not trained.
At what stage of the disease is this?
Well, about 50 to 70% of cancer patients will go through radiation at one point or the other. Basically, all of them. The standard of treatment for cervical cancer mostly involves radiation. The same thing goes for prostate cancer, the same thing goes for breast cancer. So most of the cancers will actually go through radiation. And what is even worse is the fact that they present late, and what that means is that they will come down with so many complications. Like cord compression is an oncological emergency. It's a medical emergency that requires radiation immediately. Or a woman that has stage 4 cervical cancer that is coming down with bleeding. You cannot go and say you want to remove the womb. It's not likely going to happen. So radiation, hemostatic dose of radiation is very critical to save her life.
So at the moment, the National Hospital is overwhelmed?
It has always been overwhelmed, not just now. Yes, it has always been overwhelmed, not only the number of doctors, in this country, we need about 3,000 clinical and radiation oncologists. We have about 70. And that 70, about 80% are working in places where they don't have the machines. So only about 20% of us are actually using the machines. So you can imagine what that means.
Your Excellency, what was your motivation? You are a gynecologist and obstetrician. What was the motivation into cancer? Yes.
Initially, when we started, the foundation is basically about reproductive health rights of women and ensuring the major flagship intervention that the foundation is concerned with is ensuring that women don't die during childbirth.
Okay.
Now, but women getting pregnant, having safe deliveries cannot be isolated from all the other reproductive health issues that a woman has. So you have to look at all aspects of the lady in her reproductive system of a lady. And part of that has to do with examining the cervix and things like that.
Okay.
So when I started the foundation, I came across a patient with breast cancer. And I realized that there was very little information that people had. In fact, most people had preconceived ideas and they were misinformed about really what cancer was. And when I looked at it, I realized they didn't even know what it was. And so I thought, okay, I could take part of what I do of the reproductive rights issue thing to incorporate screening of cervical. I started with cervical cancer actually, but I realized that breast was just as high. And if you are going to do a screening for a woman with the cervix, you might as well go ahead and screen her for the breast cancer. And so I decided we needed to have a center to do that. And there wasn't anything like that when I started. In fact, I launched the foundation with this cancer screening center. And so far...
So before your foundation started this screening test,
yes,
patients from larger states traveled all the way to probably Abuja?
No, actually, there isn't even anything like screening in Nigeria. There isn't any organized screening program at all in Nigeria. Ever since I was a medical student, we had been talking about, I was taught about how you can prevent cervical cancer and how the developed countries were able to reduce their load of cervical cancer based on their screening programs. But till today, you don't have a standard program in Nigeria. And so what we are doing now, what my foundation has done now, is we have partnered with the state Ministry of Health, and hopefully very soon we're going to have a screening program incorporated into all the primary healthcare system.
Okay.
So which means at any given point that a woman goes to her primary healthcare center in Niger State, she will have the opportunity to be screened for breast and cervical cancer as part of the routine, based on, because you don't screen every day, there are certain criteria for screening. So if we decide we're screening her once every 3 years or once every 5 years, she would be able to get that at the time she's supposed to, because we now have that screening program incorporated into the system.
Okay, Dr. Mohammed, as we're discussing, a lot of questions are just flushing, down my head. One is, she talked about people who didn't know that they actually had cancer. So could, lack of awareness be a reason why they present, late? And I'm also worried what is it about the breast, really? I mean, men do have breast. So what is it about the female breast that makes it, prone to cancer cells?
2 questions actually. First, the lack of awareness, yes, and Her Excellency mentioned it, that there is no institutionalized national screening program. Actually, last year, we launched the National Cancer Control Plan 2018 to 2023 by the Federal Ministry of Health. We were all involved in, drafting the document and all that. And part of it is to institutionalize the national screening program for cervical cancer, for breast cancer, for prostate cancer from age 40 for men, and so on and so forth. But for you to be able to, implement will require a lot of funding. We looked at the whole document, including diagnostics, including treatment, and so on. It will cost about 97 billion naira to actually implement that document. But it's going to be in phases. So I want to believe that there are certain things that are now being put in place. Probably what Her Excellency is doing, maybe the Ministry of Health will also come and join her so that there will be screening across board. Because that screening is so fundamental. And when
Go ahead.
And when you have screening, the next thing that will come is treatment. Because people say early detection of cancer saves life. And I said no, it's early detection and early treatment. Because if you detect and you don't treat, you are not likely going to save the person.
So, Excellency, since the coming on board of your screening center, what has been the impact?
Well, what we have, I think, number one, I think the most important thing now is there's a general awareness about cancer in my state. Because usually now when I go for a function, they always talk about me being the mother of all cancer patients, things like that. So there is an awareness there. And we started this in 2016. And I think we've screened about 10,000 women, up to about 10,000 women now. I think, let me not give you wrong statistics, but we've actually screened quite a number of women. But what we did, he said something about screening and treatment. By medical standards, it's really unethical for you to screen a patient and abandon. Then one of the criteria for screening is that if you must screen a population, you must have a way of that person having further treatment or further management after you have screened and discovered that the person has it. So what we did, we partnered with the Ministry of Health so that when we diagnose patients who have cancer, we refer to the state so that they can go ahead and take over the treatment. Now, we have been constrained because the state has not been able to organize itself to be able to provide those services. It's going to start, but it hasn't started yet. Now, so the burden now fell on us in the foundation, which we hadn't anticipated, but we've been coping. What we did notice is that we actually, from the data that we are collecting, we are getting a lot of women with breast cancer. For every population of women that we screen, we get at least 10% of those women who come up with lumps. So we follow up those patients. We make sure they get diagnosed. We take care of the surgeries. They need to remove the lumps. We do the biopsies, and we get their diagnosis for them. And then we navigate them to start the treatment immediately. What we've noticed, however, is that we have a lot of patients who run away. They abscond. Because, number one, they're scared of the diagnosis. Then they're scared of the amount of money that is involved in treating. This
will form part of our conversation in the second segment when we come back. You know why people shy away. But just for us to round off this segment.
I've not answered your second part of the question. Why breast?
Yes, yes, why breast? And today we hear that people can come up with cancer not just merely through like I said before, traditional known ways. Don't smoke, don't do this, but when you come in contact with radiation or something like that, maybe you need to clarify that for us as well.
So so the breast is one of the most dividing cells in the body, because of the way God created it, that the woman will lactate, and then so it's dividing, producing milk and so on and so forth. So that is controlled by a hormone called estrogen. Now that estrogen's function primarily is to make the woman blossom, in other words, in a simple term. So, and when that happens, she conceives, she has a baby, and then she will breastfeed and so on. So that estrogen is controlled. Now, when you don't breastfeed a baby or when you don't become pregnant, there is an unchallenged effect of estrogen on the breast. And that will make it to replicate more and more and more to the point that the genes will stop regulating that. And that's why you develop.
No,
breast
you're
cancer.
frightening me.
Yes. No, I know. This is the fact. So, of course, there are certain other factors, but basically, this is the mechanism.
Is
Men
that a reason?
do develop breast cancer, by the way. 1 in a million men will develop breast cancer, especially those that have inherited that BRCA gene that I have mentioned. So if they have inherited it from their mother, from their grandmother, from their auntie, they are likely to come down quickly with breast cancer. So men do develop breast cancer as well. There are other risk factors like the radiation you made mention. It's not your exposure, you as a person, that may develop breast cancer. There are secondary malignancies. If you have been exposed to a very high dose of radiation to the breast, maybe after 20 years or more than that, you can develop.
Please, can you break it down to us? Exposure to radiation, what are you talking about, so that people will know? You know, some people say, look, when they ask you to go for X-rays,
so I'm coming to that. Okay. So when a woman is pregnant and she exposes the fetus to radiation, that is to X-ray, the chances is that that child, the unborn female child, will develop breast cancer. So it's not actually the woman that is carrying the baby. So it's the baby, the effect of that radiation on the fetus will subsequently make her to develop breast cancer later in life.
But not you.
That's one. Not you that goes for X-ray.
If you go for X-ray,
yeah,
you will not get it because the amount, the dose is very little.
Exactly.
But it affects the baby that is in the
uterus.
In the uterus.
Because it's still dividing.
Yes.
And that will cause mutation that will come up later in life.
That can come up.
Yes. Could. Yes. Absolutely. Yes.
Later in life.
Later in life.
All right. Your Excellency, Dr. Amina Abubakar Bello and Dr. Bello Mohammed, thank you very much. We'll just take a short break. When we come back, of course, we will look at how these two distinguished personalities are standing up against the spread of cancer in Nigeria. Join us again. Welcome back. This is Late Edition. This week, our focus is standing up against cancer. And I have very wonderful, distinguished personalities here with me. I have Her Excellency, wife of the Niger State Governor, Dr. Amina Abubakar Bello. Thank you once again for joining me. I also have Dr. Bello Abubakar Mohammed, who's Chief Consultant in Clinical and Radiation Oncology at the National Hospital here in Abuja. Dr. Mohammed, thank you once again. Very interesting discussion we're having so far. But let me start off this segment, because now we'll want to look at what is being done and what is the burden like. But basically, you talked about, Dr. Mohammed, maybe when the whatever, estrogen is no longer producing, and this is the point where women go into menopause, so is that why we have more women within that age bracket coming down with cancer? Maybe you need to start with. Just to explain a little bit more. Estrogen, the hormone, well, we call them the female hormones. Basically, when a woman is exposed to estrogen for a longer time, she stands a higher risk of getting breast cancer. Let me explain further. For example, a girl who hasn't started her menstruation doesn't have estrogen going around in her system, because it is the presence of the estrogen that allows the girl to start her menstruation. So if a girl starts her menstruation early, maybe 9 years old, on other girls would have their menses 12, 15. So a girl who starts at 9 or 10 has about 3 years of exposure to estrogen more than her peers.
Exactly.
Then a woman who goes into menopause late in life, for example, because you see, once your estrogens are activated, sort of, they continue, because that's what allows you to have your cyclical menses. So the longer you have your menses before it stops, the longer you are exposed to the estrogen. So a girl who starts menses early and a woman who starts menopause late averagely here in Nigeria between 50 to 55 years. So a woman who has, who continues menstruating after 50 is more, yes, so she's more exposed to estrogen than the normal population.
And what does that translate
So it translates to the possibility of that particular lady having an increased risk of developing cancer of the breast. Risk, not
risk.
Yes,
exactly. So you have to, it's a risk, which means that you are like a lady who has that is more likely to come down with cancer than one who doesn't. But the thing is, we really can't predict whether that will happen in this particular woman or not, unless she has that BRCA gene.
Okay.
Any woman who has that BRCA gene has what she said, 60% chance of developing it. So really...
So women must go and check.
Yes, yes.
BRCA gene.
However, if you don't have the BRCA gene, the risk is the same, except that it may be higher for you who started menses early and things like that. Yeah.
Absolutely.
So what is,
And in that vein, women who breastfeed. Now, the breastfeeding produces a hormone called prolactin.
Yes.
Now, the prolactin suppresses estrogen. So
Yes.
the longer a woman breastfeeds, the more protected she is from breast cancer.
Exactly.
Yeah. So you see, we encourage women to breastfeed.
So you talk of risk factors. Her Excellency is talking, and one of the most important risk factors of developing breast cancer is being a woman. 1 out of every 8 women will develop breast cancer.
Yes, because I was going
that
to come
is
to
the statistics.
that. We understand that women come down with cancer more than the men.
Yes.
For the breast.
No, for the breast. For the breast.
And he'd
For the
explain it
breast.
because of the anatomy, the way our breast
Yes. Yes. So that is the reason.
So what is the burden like for a woman undergoing treatment?
In terms of what?
Breast cancer, cervical cancer.
The burden in terms of what?
The burden, general burden, the burden in terms of cost, the burden in terms of,
Wow.
yes.
So the breast cancer we've been talking about are different types. So we have different subset of treatment for different subset of breast cancers. You have the triple negative breast cancer. You have the HER2 type, which Her Excellency has been kind enough to support some of the patients. A cost of treatment of HER2 type breast cancer is about 20 million naira. Because the patient that is detected early will have to have treatment for at least 1 year.
Sorry, I didn't get that.
Okay, I'll repeat that. So the HER2 type is the type of breast cancer that require a certain drugs called targeted drugs. And those drugs are taken for at least 1 year if the disease is detected early. If it is detected late, it is for life. Okay, the treatment is for life or until disease progression.
And the cost?
And the cost is about 20 million naira
for the entire treatment.
the entire treatment, because it will involve those drugs. They are very expensive. We used to have just trastuzumab. Now we also have pertuzumab according to the guideline in combination. Okay, we have chemotherapy, we have surgery, we have radiation therapy, and sometimes if they are also triple positive, you also have hormonal therapy for those patients. So when you look at the total gamut of treatment that the patient actually require, it's so expensive that it is almost impossible for anybody to bear. And the unfortunate thing is that it's out of pocket in most of the patients. The National Health Insurance has not covered treatment of cancer, all cancers.
Excellency.
And that is very, very, very sad.
Is that why some of them run away?
Yeah, definitely.
Definitely.
Definitely, because you see, it's for a lot of people, the death sentence of cancer is not just about having the cancer that can kill you. It impoverishes families. It's called catastrophic health spending.
Yes.
Because it eats into the economy of an entire family just for that one treatment. You can imagine, he said for that HER2 kind of, you have to, how many families do have even $1 million naira and they are asking them to spend 20 million naira? So, as long as we do not have a way of supporting patients that have breast cancer or cancer in general, it will be very difficult to have a significant improvement in the mortality rates that we're recording here in Nigeria.
When you make referrals after screening to the hospitals, do you do follow-ups?
Oh yes, we do. We do. We have to. Fortunately for us, even though we are getting patients, there are not so many, because up till now, it's not everybody that avails themselves to screening. In fact, most of the patients that we get are those that we go, we detect when we go on outreaches to local government. We struggle to get women to come into our center to be screened. We usually open up our doors for free screening in the month of October. Usually women, when they come, we ask them to pay a token sum of 100 naira, just so that we can continue buying the things that we need. But when it's October, we ask them to come and we give them for free. But they hardly ever come. So what we do is we go out according to local government by local government. We arrange 2 or 3 days of health outreaches, and we screen the women there and then. And when we screen them and we detect them, for the cervical cancer, what we usually do is we screen them with a process called VIA, which is visual inspection with acetic acid. It tells us whether a woman has a precancerous region, and we treat her immediately there. Because we are worried that if we don't, she will never come back to us. But when you treat them, they will come to you back for follow-up. And when we detect that it is actually cancerous, because you can tell that this one has gone beyond a precancerous region, so we now transport her back to our center in Mina, which is the state capital, and we start monitoring her from there. So quite a number of our patients that we have gotten, we have been following them up religiously, so we have their data. But some of them do not come back to us, even when we call. There are some that we call consistently, and they tell us no, nobody's going to touch them. And there's this very terrible misconception that people get from our local traditional healers, that if you have breast cancer and you allow the person to put a needle in the breast, you are going to die immediately. And so they don't come back to us because they know we're going to take them for biopsies. And so, and this with breast cancer, the longer you keep it, the more it spreads. So,
yes, another question I'd like to, because we've had, some people who say even when they present early, some still die. Dr. Mohammed, I don't know.
Well, so there are individual pattern of progression of the disease. Okay, but basically the standard is that if you have an early disease and it is detected early and it is treated early, chances of your survival is much higher. That is why we have 5 years survival for stage 1, which is over 85%, for stage 2, which is about 65%, for stage 3, which is about 30%, for stage 4, which is about 10-15% in the best of centers. Because you must go through all the processes, all the treatment based on guidelines that we have been developing. Okay, so if you don't go through that, the chances of dying, it's really quite high. And like Her Excellency mentioned, people will just disappear. Some are in denial. Some will outrightly refuse the treatment. They will come and tell you, I don't want chemotherapy. I have a patient, an enlightened woman who has developed metastasis as a result of her disease, and she is still refusing to have chemotherapy in spite of all the things that she's having. She believes that the chemotherapy is what is going to kill her. And I keep telling our people...
That's a common belief.
Yes. And I keep telling our people that, look, the white man loves this life more than us. If chemotherapy is something that is killing them, certainly they are not going to do it.
The problem with chemotherapy is that there are a lot of side effects.
Yes.
You see, the problem with, maybe to understand it, with cancer, right? It is a development from normal cells. So the drugs that you use to attack the cancers cannot differentiate between the normal cells and the abnormal cells. Although the abnormal cells are more they are more sensitive. They will die.
Have some lethal damage.
Exactly. So, but the normal ones will have some damage, but not. So it is the damage from the normal ones that you get the side effects. So depending on what the drug is, you can have some people. The most common one is people lose their hair, because it affects the hair follicles and things like that. Then there's vomiting. There's this general body weakness. There could be diarrhea. So sometimes the side effects are so severe for some people that they feel that they feel that is going to kill them more. But the truth of the matter is they're just side effects.
Some people have, of course, we have survivors, that are going about telling their stories and, impacting on other people. Dr. Mohammed, in terms of cost and treatment, how friendly is the National Hospital Abuja?
Well, the National Hospital, just like any other government hospital, is highly subsidized. I will tell you that, yes, the cost of radical radiation therapy is about 600,000. Not many people can afford it. But if you travel to India, you pay 3 times that amount. Most of the people that travel to India and say they have fantastic treatment and so on, don't even go to government hospitals. They all go to private hospitals and they pay through their nose. So it is not the same thing. Here we are overstretched and everybody must be accommodated as quickly as humanly possible and so on. And the cost is so low that when it breaks down, you are unable to even do the maintenance. So government must produce, money to maintain those machines, the equipments, and change and do turnaround maintenance and so on and so forth. So it's really, really affordable. But when you look at the population that are so poor, you will say that it is not affordable. And the truth is, cancer care in most countries of the world are taken over by insurance. So that, because it, like she mentioned, it is a catastrophic disease, okay, and causes financial toxicity. So to prevent that from happening, people key into insurance. All these targeted drugs that I made mention of are not covered as out of pocket elsewhere. It's only in this country. And we've been talking to the insurance that, look, they really need to do something about it. Otherwise, I can't afford it. If one of my family members has breast cancer, HER2 positive, I cannot afford it with my salary. And that is the truth.
Yes, God forbid. Say that. In this area, I'm wondering, again, because he has said, medical experts advise policy change and all that. What are your thoughts in this area? I know you've been organizing events. I was privileged to attend to one of those. So what are your thoughts? What kind of policy, change do you envisage?
Basically, it's a reiteration of what he is saying. Unless government is able to incorporate cancer treatment within the health insurance scheme, we're not going to get very far. And this is what I'm trying to do. Right now, like I told you earlier, our foundation is working with the Ministry of Health. We have adopted the National Cancer Control Plan that was released. Yeah. We have adopted it for our state, and we're in the process of actually, what do you call it now? Adapting it to our own state in our own way. And my foundation is working with the Ministry of Health to do that. Now, one of the things that we have done in that particular aspect is to incorporate screening services for breast, cervical, and prostate cancer within the state insurance scheme. Okay. So if a woman or a man comes for their annual medical examination, which is part of the minimum package that the plan is, she will get her screening for cervical cancer and breast cancer. And that is how we're institutionalizing screening into it. Now, the next step is actually treatment. So we are still in the process of looking to see how are we going to get funding, because what the health insurance scheme for the state is doing is trying to provide as much as it can for its citizens. And I have to say, I'm quite impressed with the package that they have come up with. However, for them to be able to put cancer care within the health insurance scheme, they have to increase the premium so high. Exactly. Which is what they don't want to do, because basically you are looking for universal coverage for all. So you are looking at the minimum affordable cost that a person, ordinary Niger State individual, can pay as a premium. If you now add cancer care into it, that premium shoots up, and majority of your population will not afford it. So that's the dilemma for the health insurance scheme.
But so we're now
exactly. So now we're looking at other alternatives to see how the state can find a way to fund chronic cases, because it's not just cancer. You have renal disease. In Niger State, we have one of the nephrology centers where we do dialysis at a highly subsidized rate. So we have a lot of people with chronic kidney disease, which is also another disease that causes catastrophic funding for the catastrophic, hospital costs for families. So we're now looking at a way that we can have a separate funding which can be incorporated into find a way to get funding to incorporate in the health scheme so that people can access it through the health insurance scheme. We're still working on it, and we're hoping that we can find a way where the government can produce some money, like a basket fund for that can be tapped into the health insurance scheme. So this is basically what I'm working at. Okay. I'm hopeful that within the next few years, we will be able to achieve that in our state.
In Niger State.
Yes.
Does that look like a plan that we could spread to
the national level?
Yes.
I absolutely agree with her. The truth of the matter is that if there is a will, there is always a way. If we are able to institutionalize the National Housing Fund since 1992 to date, and people are paying from their salaries and they are not even assessing the houses, why can't we have a national health fund that people will be paying certain premium, and then if, God forbid, at the end of their life they develop cancers, they will get the best of treatment? Because that money is not only going to be used for treatment, it's also going to be used to provide infrastructures that are lacking. Because, Niger State are working very hard to get a radiotherapy machine. They don't have. We have 5. We need 180. So you can see the gap, between 5 and 180. So there must be an innovative way of funding those equipment and all that. I'm very happy to say that I saw one of the debate of the National Assembly, I think a member from Kebbi State, Dr. Sunonu, actually advocated that we should have 2 radiotherapy centers in all the 6 geopolitical zones. And I think that is a very good start. If the National Assembly will provide funding for that, it will go a long way for people to stop going to India, to Egypt, around the world. You'll be shocked to realize that today people go to Kenya from Nigeria to go and assess treatment for cancer. And I think that is not really acceptable. So if there's a will, there should be a way.
When I think of these cancer, honestly, it's very fearful. But I also remember there was a time in this country when HIV and AIDS, was ravaging. And people thought, people were going to, HIV and AIDS were going to finish, the population. But today, we have a good track record. Ebola came and Nigeria, was able to, that spirit and political will that, we deployed.
That's the will I'm talking of. If there is a will, there is a way.
One of the ways in which we can even handle this crisis of the cervical cancer is taking the same method that was approached for HIV.
Yes.
The same approach that was used for HIV is the same approach you need for cervical cancer. Cervical cancer, apart from it being identified at an early stage, it has a vaccine that can actually prevent it from happening. Yes. Now, with cervical cancer, we know that what causes it is a virus called HPV, human papilloma virus. Now, that virus is transmitted through sexual contact, and usually it is in the first few sexual contacts, maybe the first sexual intercourse or something, that the person will get the disease. So the idea is, if girls and boys are vaccinated before their sexual debut, they are not likely to get HPV, and it means that within a few years you are not going to have anybody with anything called cervical cancer again. See? So in countries like in the Western world, it is there, they have HPV, their girls are being vaccinated against it. And in some African countries, like Zambia now,
Yes.
Zambia has institutionalized HPV vaccines within their secondary schools.
Yes.
So every girl that goes through the educational system is going to be vaccinated against HPV. So this is something that Nigeria needs to do.
Good.
You know how we have the EPI, you have the polio.
Yeah.
We need to have the HPV vaccine within the immunization schedule in the country.
That's good. And my other question would also be to Your Excellency. I know recently you were appointed as a member of the WHO Technical Group on elimination of cervical cancer.
Yes, that's right.
On the global level, what strategy is working out?
Now, based on the experiences that we have had, all this things that we have told you, that is exactly what is working. Screening and HPV for cervical cancer, screening and early treatment, as well as HPV vaccination. For example, in India now, you have states in India that have institutionalized their screening, and they use VIA and acetic acid, and they treat. And you also have places that you have in the country that they give HPV vaccines, and that is showing tremendous improvement in everything that they're doing now. People like places like Australia that have already gone beyond the screening services and HPV, now they're looking at ways to simplify HPV testing. They've gone so far. Yes. So basically, this is the way to go.
We have just a few minutes, to round off, and I'm going to end on this note. Of course, we must look at. I like for Dr. Mohammed also, because I know you have a flight to catch, and it's basically to give a talk on this matter on the global level. So let's look at your own perspective, global strategy, and also preventive measures, recommendations. Beyond the no smoking, no this, no that, I see a lot of write-ups on, some, on health benefit of some vegetables and plants. Dr. Mohammed, quickly, we have less than 2 minutes.
Okay, so yes, there are certain dietary aspects that have been alluded to that could prevent some type of cancers, like eating a lot of tomatoes that can prevent prostate cancer, and so on and so forth. But fundamentally, eating right is very critical.
What about ginger and garlic?
Well, these are a lot of things that are not evidence-based actually, but people use them and they think that they work for them. And if they do, why not? But it's not something that you'll see in the textbook of medicine, that yes, ginger can prevent all kind of cancers.
So it could
but
slow
people
down.
Said yes, this and that. But the general perception is that eat well, eat right.
Eat the good foods, the vegetables and the fruits.
Yes.
Reduce your processed foods, reduce your sugar. Eat as organic as you can and as much natural foods as possible. Of course, things like meat, you have to reduce the amount of meat you eat. Rather eat fish, white meat rather than red meat, that kind of a thing. But basically, when you eat healthy and you exercise, it's not just about eating healthy.
Yes.
Keep a healthy lifestyle, good food and exercise.
All right. Good food and exercise. That's one way, of course, to prevent getting any of the cancer. Let me appreciate Dr. Bello Abubakar Mohammed, Chief Consultant in Clinical and Radiation Oncology at the National Hospital, Abuja. I'd like to thank you very much, Your Excellency.
Thank you for
Dr. Amina Abubakar Bello. I've been at it for a long time. Thank you today. Today I realized my dreams. Thank you very much for finding time to join me. Thank you. That's it this week on Late Edition. I'd like to thank you. That's how we've been standing up against cancer. And one sure thing to prevent it, eat well, and of course, exercise. And get the right treatment. Don't shy away. From me and the rest of the crew. Bye-bye.